Hi, welcome to the channel, and today we are going to discuss a case of proptosis. And this time the proptosis we're going to discuss is a proptosis which is coming in from the inferior side. And here you can see, if I draw a line over here, and you will see that this line will go over this area. So if I draw this straight line, this is over here, but if I draw it over here, you can see this is the area which is above. So this is the area which is above. So this is one way of measuring the dystopia, that you put a ruler at the pupillary plane and then check how much it goes above, or you can have a reference ruler above and you can measure the distance which you have from above to this area and to the center of the pupil, and here you can see this area is more. So this patient has about 5 to 6 millimeters dystopia superiorly. So if you look at this patient, your thoughts should be, where is the lesion going to be in these patients? So in these patients, the lesion is most probably going to be coming from the inferior area, and the lower part where the thing can come is the area where it is the maxillary sinus. So if I want to ask the patient to move the eyes, so I'll be looking if there's any problem in looking down, and this is movements to the right and then to the left and superiorly. And the next thing you want to do is to do retropulsion and to see if there's proptosis which is causing the orbit to fill up. Then you look at the rims of the orbit and to see if there's any abnormality, and then you feel the lesion. Here you can see the margins of the lesion which are over here medially and laterally, and you can feel it's a firm hard mass which you can see, which is pushing the globe upward, as you can see in this patient. And this is, I'm doing retropulsion. You want to ask if you can feel the sensations, if the sensations are intact in this patient or not, because if the sensations are affected, then obviously you are going to know that there is some sort of tumor which is invading that area and causing the problem. So if we go forward and look at the CT scan of this patient, we will see that we can see the scan over here. This is the coronal slice of the patient which you see over here, and if you see, the lesion is coming from this area below the orbit. So this is the CT scan, and this is a coronal slice of the patient which you're seeing over here. And if you go forward on this slice, you can see we are going backward on the slice, and you can see the eyeball becomes smaller in this area over here. The eyeball is smaller over here compared to the other part, so that this will help us delineate the area, which tells us this patient has got, this is the CT scan going from, the pictures are from behind, not from the front area over here. And if you go forward on the CT scan, you will see, if I take the slice further forward, now the slice is gone behind the eyeball. You can see the optic nerve over here, and it's now you can see going further back, there's bulk of the growth which is present over in that area, and then going towards the apex of the orbit, you can see there's the growth which is finishing in on that area. And last, you can see an axial scan, and the axial scan just shows you proptosis because it is at the level of the recti, and the lesion is below below that area. So it is very important when you're seeing these patients that you need to understand where the lesion is and how you're going to approach it. So what are the investigations which you want to do in these patients? Number one is you want to do an ultrasound of that lesion to see if it's solid or cystic. Then you want to do a CT scan to see if there's bone involvement. MRI scan if you want to see if the soft tissue, what's the characteristics of the soft tissue which you have. And once you've done that, your plan is going to be a biopsy of that lesion. The biopsy can be either an incisional biopsy or it can be an excisional biopsy. So you have to plan on that, and it's very important. You can take an infraciliary incision. If I go over here, and if I make that incision just about 2 to 3 millimeter below the lid margin, you can go over there, go in the suborbicularis plane, and you will have the septum over here, and you cut the septum and the growth will be there. So depends where the growth is coming from, and usually looking at this CT scan, it looks like it most probably is a type of lesion which is more a solid lesion, and fungal growth from the sinuses are very common in this patient. So very important decision is to decide if it's a non-axial or an axial proptosis, and if it is a non-axial proptosis, to decide where the lesion is. And once you've localized that, then you need to do, if it's a big lesion and you cannot excise it, so do mention in your exam that you need to do an incision biopsy. Thank you very much for watching. Please subscribe to the channel and like the video. Thank you.